to everyone for coming this afternoon. Partly, I guess, to hear about this partnership we've been developing at MCHP called Spectrum. I wanted to start with a bit of background. We've had dedicated funding for Spectrum for the last 2 years, but the work building up to the Spectrum partnership has been happening really for almost a couple of decades. And there are a few things that sort of align to make that happen. As you know, we've been using for many decades the administrative health data at MCHP. Since the early 2000s, we've also have been getting social services data. We've got data from the Department of Education, things like enrollment, assessments. We've got data sets from, I'll say, the Department of Families, although some of these move around to different departments, things like housing, income assistance, and child welfare. We've got a lot of program data. A lot of it came from the former Healthy Child Manitoba, things like the Families First Home Visiting and the Healthy Baby Program data. And then most recently, data from the Department of Justice. So there really is this opportunity to put these pieces of information together to build some major insights about health, well-being, social determinants of health. But we really, felt that the power of these data for conducting social policy research wasn't fully realized. We have used these data for many projects. We at MCHP, at least, speaking for myself, I'm not a content expert in social services or justice or education. So we saw the need to create a research partnership to really capitalize on these great social data that we have for social policy research. And that's where Spectrum was born. You can see there what Spectrum stands for: Social Policy Evaluation Collaborative Team Research at Universities in Manitoba. We love our acronyms. And this one I think is great. It's funded by a partnership development grant from the Social Sciences and Humanities Research Council of Canada. 3 years of funding, and with that funding, we are looking to find innovative ways to really, ultimately improve the health and well-being of Manitobans. We're doing it in partnership so that we can learn from each other about challenges and opportunities. Really, at the focus of this is leveraging the potential of the repository at MCHP and other unique data resources, and ultimately to increase capacity for conducting social policy research and evaluation in Manitoba. We really, came at this saying we want to figure out a way that we can address wicked or complex social challenges. MCHP has a really long history of working in partnership, particularly academic researchers working with staff from government departments. And we want to continue that with Spectrum, expanding the government departments we work with, expanding beyond academic researchers within MCHP, beyond our department, our university college, our faculty throughout the university and beyond even University of Manitoba. But really key to Spectrum is bringing in community agencies into this partnership. So it's really a three-way partnership. Now, it's not like we can just bring these groups together and magic happens. It doesn't happen automatically. Each of these groups has different ways of perceiving social challenges and going about tackling them. So the beauty of this partnership development grant is it gives us time and space to develop trust and really build on the partnership, develop trust and relationships and processes for working together. A big chunk of the funding is for workshops. We received the funding in May of 2019, and in our proposal, it's 3 years of funding. In our proposal, we said we were going to have, 4 or more in-person workshops a year. And we really hit the ground running. We had our first full day in-person workshop in September of 2019, a chance for all the partners, to really get excited about Spectrum. As I said, many of us had been meeting for years. This goes back a long way, the idea of Spectrum, but really coming together and saying, okay, what is it we want to do in this partnership? How are we going to work together? A lot of momentum going. We had another full-day workshop in December of 2019. Again, lots of excitement, momentum. We had our third full-day workshop planned for March 2020. Of course, everybody knows what happened in March 2020. We had to, at first we were very optimistic. We just postponed it and said, you know, oh, we'll get together again when this pandemic is over. And, you know, very soon started to realize that we had to change our thinking. We weren't going to be able to have these full day in-person workshops. So in the fall of 2020, we started holding virtual workshops. And, you know, still a lot of work could be done. We, of course, had to reduce the length of those because we know, you know, people can't be online all day. But we did a lot through email and other communications as well. From the initial in-person workshops, we established three working groups, three main working groups, focusing on really what is it that Spectrum is. Our partners were saying, you know, they were trying to tell people about what it was we were doing, and they really didn't have a good description. We developed a working group on values. What did we want the values of the partnership to be, and also processes for working together. This is what we've come up with for our mission, or for telling people what Spectrum is. It really is about all of us coming together to use information, whether that comes from data or lived experience, ultimately to make Manitoba a fairer and more just place to live. We do have a commitment to work together, and that by working together, we'll do more than working alone. As I said, the three sort of main sectors in the partnership are community organization representatives, government staff, and academics, which includes researchers and students. Innovative ways to solve those wicked problems is why we're doing it. Predominantly focusing on the repository, but not exclusively. And then you can see our ultimate goal is really to make things better across all sorts of sectors. In terms of values, the values working group, you know, we talked about values at a couple of our workshops, and then the working group went away and really distilled things down to these five main values. Collaboration, obviously working together, compassion, really holding space for different perspectives and experiences, courage to speak freely and share our knowledge for collective benefit, focusing on creativity and innovation, and respect for diversity. So here, really not privileging one type of wisdom or way of knowing over others. The group had talked about having a sixth value of anti-oppression and decolonizing, and it definitely is one of our values, but we decided that it needed to be a sort of Siri's talking to me. Overarching overarching lens, the anti-oppression and decolonization. So I have to credit Myra Tate for this fantastic representation of the way Spectrum works. There's a lot going on in this, but I do want to point out that it really shows it's not typical. It's not a typical organizational chart where you have hierarchical relationships. It's horizontal, and the lines here are not lines of authority, but lines of relationships. Not that you have to read all these, but over here in the green, and I don't know if you can even see my pointer, but on the left-hand side of the circle in the green are our community partners. You can see there's some empty circles, so we are bringing on new partners all the time. Up at the top right in gold are the government sectors, or the government departments, and then the purple is the academics. And again, you can see everybody's sort of contributing to the space and structure, what Spectrum is, and the values. I want to spend the rest of the time talking about a demonstration project that we've been doing, really to demonstrate how it is that we can work together to produce research or evidence that may inform policy. So demonstration project 1, we call it, when we put in the proposal to SSHRC to get the funding, We had already met with a lot of our partners, mostly academics and government partners, some community partners. But when we put in the proposal, we said, oh, we'll do a demonstration project, and why don't we make it high users of multiple government systems? And, everybody was really excited about that. We put in the proposal. When we brought it to the partnership at one of the fall workshops, our government agency representatives said, oh, no, that sounds really like it's going to be a victim blaming or hotspotting project. We really need to rethink this. And so we had a lot of discussion amongst the partners. We decided that we would focus on children and youth. We would focus on something to do with positive trajectories, strength-based approach. And really, we decided at that point, after some discussion as well as emails back and forth, that we would focus on the child welfare system, because it is a system that really touches all sorts of aspects: education, justice, and health. So these are the team members of Demonstration Project 1. I'm not going to read all their names out, but I wanted to show this to show that we've got representation from each of those three sectors, from community organizations. We've got MF NERC and FINISHM, from government, central services and families, researchers from MCHP and social work, the Masters of Indigenous Knowledges program, and then a lot of students have been involved in this too. So when we started meeting as a group, we really narrowed our focus, and we decided that what we wanted to do was compare outcomes, health outcomes, education outcomes, and justice outcomes between children who were taken into care and children who there are protection concerns, but Child and Family Services doesn't take them into care. They receive services while remaining in their home. There is an anecdotal understanding that these kids, the kids who are not taken into care, are going to do better, but there really is not quantitative evidence out there to show that. Now, you might be thinking, well, it's not really a fair comparison, or it might be an uneven comparison because the children taken into care, they obviously have more challenges, those are the reasons they got taken into care. And so we had to find out some way to make this a more even comparison. So we can think of kids who become involved in child and family services along a spectrum. And along the bottom there, you can see that it really is, it goes from one end to the other. Many of the kids who come in and families who come in contact with Child and Family Services they're safe at home. Their parents may need some supports or services, but there's really no intervention that's needed other than that. At the other end of the spectrum are kids who need to be taken into care in order to keep them safe. But what we know is there's sort of this gray area, or in this case, it's purple, where there may be a lot of uncertainty. There's discretion about whether or not the kids will go into care or not. So you might have a kid who, if he's served in one agency or by one worker, they may make the decision to take him into care. But had he been served somewhere else, he could be the exact same kid with the exact same characteristics. The decision might be that he can be kept safe at home with a plan. And so we want to focus on that group of kids, the kids in the purple there, and be able to make those comparisons. And all I'll say about it now is that we're using some fancy statistical procedure that allows us to do that allows us to identify that overlap group of kids. So we really are comparing apples to apples when we compare kids who have been taken into care to kids who have stayed at home, but there's protection issues. So this is, kind of a long laundry list of some of the outcomes that we could look at using our data. We probably won't get to all of them, but this will be something that we decide as a team and with our advisory circle, which I'll talk a bit about in a minute. But lots of things that we can look at with the repository. Of course, we are using the repository of data at MCHP. I do want to point out that we recognize that the data we're working with, they represent lived experience, and the reality in Manitoba is that most of the children taken into care are Indigenous, and that is the result of systemic and structural racism and biases, and Alan touched on that in his land acknowledgement. We recognize these biases are reflected in the data that we use. So we are working closely in partnership and on the advice of the Health Information Research Governance Committee. We have formed an advisory circle for our demonstration Project One that includes the First Nations Family Advocate as well as knowledge keepers who will help to provide context for the findings. We will continue to center the values that I talked about earlier, particularly compassion and that decolonization lens to the work that we're doing. So in terms of where we're at with this project, as many of you know, in order to use any of the data in the repository, we do need permission from a number of different, or approval from a number of different bodies. Ethics, the University Ethics, the Health Information Privacy Committee. We need approval from the non-health data providers. And as well, the Health Information Research Governance Committee, just because we're focusing on kids in care and so many of them are First Nations. We have approval from all these groups, with the exception of Health Information Research Governance Committee, from whom we have conditional approval. We got conditional approval in May, and we have addressed those conditions, and one of those conditions was forming that advisory circle I just mentioned. And so we're hoping to get full approval soon and be able to start the research. So once all the approvals are in place, we will of course conduct our analysis, and we hope that we'll be able to produce some real solid quantitative evidence that will help to inform policy, that ultimately will help to reduce the number of children in care in Manitoba. We know we have some of the highest rates in the world. But we're not naive enough to think that just rigorous evidence alone can change policy. And so, you know, 2 of our workshops this fall are focused specifically on policy. How is policy made, the policy cycle, as well as how do we frame evidence in order to influence policy, and having policymakers and decision makers on our project team will help us move that forward. So really it's turning evidence to action, and that's why I put the little E2A symbol there. And you know, my hope is that by next year at this time, we will be able to come back and present the very exciting results from this in person, I hope. Just before I stop, you know, I want to acknowledge all the partners in Spectrum. I, you know, couldn't list them all or you wouldn't be able to read them. But also particularly, we've got a sort of a core team group who helps to guide us through this very messy and complex process. And their names are shown there. As well in the center here, we've had some fantastic fellows and have some fantastic fellows doing a lot of the legwork for us. So thanks to the entire core. And I'll stop there, but I will point out we do have a website. The link is down there, but all you have to do is Google Spectrum Manitoba and you can find it. Thank you.